Okay, so welcome to tonight's presentation. My name is Amanda, and of course, I am one of the registered dietitians here at Functional Nutrition RX. So tonight is going to be part two of our Foundations for Resilient Health, Blood Sugar, Medications, and You. Our part two is going to be about supporting whole body wellness while we are taking a GLP-1 or GIP combination medication for weight loss or blood sugar management. So, of course, an overview of what we're going to cover today. How do the more modern weight loss medications work, specifically the GLPs and GIPs? Understanding Ozempic, Wegovy, Mounjaro, and how to balance our lifestyle and our diet if we are taking one of those medications. How to prevent any side effects that we might incur, especially long-term success while taking the medications is what we want to also aim for. We're going to target muscle, bone, gut health, as well as metabolic flexibility today, and learn a little bit more about our body's hunger cues and signals that is relayed to us, and of course, most importantly, going into ways to support our lifestyle. So just a recap from last presentation, what does blood sugar mean? Because we're going to be talking about this a bit. So blood sugar or glucose, right? Those terms are synonym terms. Most of the carbs that we consume break down to sugar or glucose, which is the smallest unit of a carbohydrate in the body. Blood sugar is the primary source of energy derived from what we eat. So we can derive energy from dietary fats and protein, of course. However, carbohydrates are the primary fuel source. Our body will transport glucose to all of our body cells, so it gets into our eyes, our muscles, our nerves, etc., as well, of course, as our circulatory system. And diabetes is a condition in which our blood sugars rise abnormally high for what's high for us, typically above 125 milligrams per deciliter fasting. And if we do not have enough insulin or there's insulin resistance presence in the body, we tend to find blood sugar levels starting to rise a little bit more abnormally, which would be considered hyperglycemia. So the mechanism of insulin resistance. So we went really in depth in here last session, but of course I think it's very important to talk about. So insulin resistance, just as a review, is insulin is produced by the beta cells of the pancreas. That's released when our body ingests carbohydrates, and those carbohydrates start to break down as glucose. That glucose, we want it to be able to enter the cell so it could be utilized for energy or stored to later use for energy. However, insulin resistance, we like to use the analogy of the locks are getting changed. So in order for that glucose to enter the cell, we need that receptor to sense that the insulin is present to allow it to enter. So it's almost as if the keys are just not working and you need more and more insulin to open the cell. So there's insulin resistance, meaning there's a resistance to having the normal lower level of insulin that you would have been able to typically in the past help that glucose enter the cell, but now that body needs a little bit more to be able to do its job. So that's essentially what the crux of insulin resistance actually is. Hunger and fullness now. These are just important vocab terms to be aware of as we go throughout the presentation. Normal hunger and fullness signals that our body will rely upon comes from ghrelin and leptin typically. So ghrelin is a hunger hormone that typically rises before meals. Think ghrelin, I'm growling. Hunger, my stomach is growling. Leptin signals long-term fullness or satiety, so we're more full when we have more leptin. Leptin resistance is a term that gets talked about in the functional community sometimes, and that's kind of inferring that the person is not feeling full or satiated. Stretch receptors are in the stomach, and they're actually muscular receptors that tell our body and our brain that we are physically full. Oh, sorry, I just kicked out. Oh, there's a pop-up. Thank you for letting me know. Um, How long was this going on for, guys? I'm sorry, I was not aware until I just saw that message. Um, Give me one moment to fix this. We got this. Present full screen. Let's exit and just restart again. Can you see my screen? Verbal is extremely helpful if you guys can, just because I have to close out of the presentation mode and then go back into read the chat.
I didn't want to interrupt you, sorry.
It's okay. Can you guys see the screen?
I still see the pop-up that says present with watermark.
Oh, resume. Let's see. Saying now screen sharing is pause. I'm gonna step out of it and step back into it again. And just close out my browser. Don't we love technology? Let's see. Let's let it load. Okay, resetting and share. Let's see if it wants to present. Beautiful present. All right, is it showing up now?
No, to see you.
Oh goodness. Let's go in here now. More share, share. I need an assistant, I think. Here we go. Share. Beautiful. Can you guys see now?
Okay, that looks good. Yep.
Beautiful, beautiful. Thank you, Carla.
When you hit present, that's when that comes up though.
Every time, every time. Is it showing up on you guys' end?
It still has that pop-up and it says present with watermark.
It's still doing this.
It was good until you hit that present button.
Yeah, and I have
Yeah,
to,
okay, good, right there.
Yeah, it's
yeah,
good.
but now I'm not in presentation mode, and every time I present, I'm always in presentation mode. So,
Hmm.
okay, we're gonna resume as is. Sorry, guys, and I'm gonna call Canva later. So stretch receptors, right, in the stomach, they tell your brain that you're physically full. So when the stomach starts to stretch and expand, it does send signals to your body and to your brain that you are full, which is very cool. Blood sugar stability. When we use that term, that can just refer to the peaks and valleys or spikes and crashes, referring to elevating blood sugar and descending blood sugars. Incretin hormones, that's a big vocab term that is extremely important to highlight when discussing GLP, GIP medications. So the incretin hormones, they're hormones made in the gut that our bodies make naturally, endogenously. So, incretin hormones can travel up to the brain as our gut and our brain are connected. It's a two-way highway. Our brain communicates to the microbes in our gut, and the microbes in our gut communicate to our brain. The vagus nerve is almost like the LIE conducting this, just to help put those pieces together a bit. So, they're gut-derived hormones that they're made actually from the bacteria in the gut. It's not that our body is per se making it directly, right? So we need help from that bacteria to maintain a healthy gut lining to allow for these incretin hormones to thrive. So, two key incretin hormones that you're going to see a lot, and you probably are seeing a lot with the GLP medications, is GLP-1. That's the main one, and GIP. So, GLP-1 helps to slow down digestion. We're going to get a lot more specific into these, but just in general, they help to slow down digestion and regulate blood sugar and reduce appetite. GIP medications, the glucose dependent insulinotropic polypeptides, those are hormones also produced in your gut, and those are more in your small intestine. And it helps to play a role in blood sugar regulation after you eat when sugar is already in the bloodstream. So the medications mimic the natural peptides in your body. They delay the stomach emptying, enhance insulin secretion to help that sugar enter the cell to be utilized and hopefully burned, right? To reduce hunger. And then it helps people to eat less, feel fuller longer, and avoid spikes and crashes, right? So there's glucose regulation going on to help with body composition, but the biggest mechanism that they help is with hunger and fullness. So the person tends to feel a lot more satiated and full, and then therefore they take in a little less calories. That's part of it, but we cannot cannot disregard the blood sugar effects of it. Are the slides resuming okay? And you guys seeing it like big enough that it's blown up though? Fingers crossed. Ooh, guys, are the slides resuming okay?
Yes, sorry, I couldn't get mute off.
Oh, you're fine. It gets stuck for me sometimes too. That's all good. All right, perfect. As long as it's showing. So just a little history. So the GLP medications, GIP medications, as many of us know, they're not the new guys on the street. There has been past approaches with weight loss medications in the past. So phentermine was a very popular one. We had seen it suppresses appetite, but a lot of the past ones, like ephedra, caused issues and side effects relating to heart abnormalities, elevated heart rate. So people who had risk for heart disease or blood pressure abnormalities could really be put at risk, especially for stroke. You do see those medications used still to this day, but it's very selective in certain patients that have tried and failed other medications. And now I don't really see those medications prescribed as heavily unless someone's really trying a GLP or a GIP and I see their provider wanting to just try something different for them. Or maybe they're not able to get a GLP or GIP covered by their insurance. So sometimes you do see those medications still used, but they are not first line anymore. And many times it was due to the side effects. So, like orlistat was being utilized as it helps to reduce fat absorption in the body. However, there was side effects of that fat malabsorption causing issues with using the restroom. So unexplained like leakage for some individuals. So the GIP is, even though there are side effects that we will go through, they are much more mild than previous medications in its class, which is just interesting to be aware of and just knowing that things, history kind of repeats itself a little bit, but hopefully we evolve and things get better, right? So, what are GLP medications? So, GLP stands for glucagon like peptide 1. So, like we were saying, it's a natural hormone that slows down that stomach emptying, tells the brain you're full, I'm not really craving those carbohydrates, helps insulin to work more effectively to let that sugar enter that cell to hopefully be burned and utilized, lowers sugar and cravings because that sugar is being more utilized. We have more metabolic flexibility. And what GLPs do in our body, it's technically like a hormone replacement medication because we're replacing the GLP-1 that, not necessarily replacing, but adding that GLP-1 that would naturally be produced in the body. So, with the addition of the medication, it typically makes us feel much more full because our stomach emptying is slowing. Food is moving much more slower through our body. That slower stomach emptying makes us feel fuller longer. That increase in insulin, when is needed, helps us to let the sugar enter. There's a reduction in glucagon, which prevents the glucose spikes. So, glucagon, we touched very briefly on, raises blood sugars as needed. And it's thought that some individuals might have some abnormalities with their glucagon regulation. So, if someone doesn't really have issues with insulin, but they have issues with weight loss, they're trying to do everything possible that they can. That it is rare, but some individuals do have issues with their alpha cells that make glucagon in the body, and they have overactive or underactive glucagon. So, this is where they can help to stabilize those individuals. Medications, like I said, mimic the GLPs in the body and amplify the effect even more so. They're typically naturally released by the gut after eating, typically in the L cells. They don't usually cause low blood sugar unless paired with insulin or sulfonylureas. So if someone is a diabetic and a type 2 diabetic, not a type 1 is not cleared for this. Type 2 diabetic, if they're using this medication in conjunction with insulin or sulfonylureas, they're at risk for low blood sugars. But on its own, you're not prone for a risk of going hypoglycemic, low blood sugar. And then now, which is really interesting, the GLP-1 medications, because coverage has expanded a bit more, it's starting to become more of a frontline approach for glucose management before metformin. And of course, if you guys are aware of metformin, metformin has been around for years. And typically, when I see a patient's blood sugars first start to rise and it's a little out of control, and the doctor is definitely urging medication use. Typically in the past, metformin was always recommended first. Now I rarely see metformin recommended as much. It's more so the GLP-1 is recommended first, and then often if they're not covered for a GLP-1 or they don't want to use a GLP-1, I'm seeing metformin recommended more for that. So endogenous versus exogenous. Endogenous is your body's way of making the GLPs. So like we said, they're produced naturally. It helps with insulin's release, slowing digestion, reducing appetite, but it's short-lived and broken down in just a few minutes by an enzyme called DPP4. And it's often not strong enough in people who may have obesity or insulin resistance due to many factors that could cause this. Exogenous GLP, exogenous outside of the body, is a synthetic version. So that's like the Ozempics, the Wegovy's, the Saxendas. So they're designed to resist the breakdown a little bit more. They last a lot longer in the body. So that's why typically there is a titration in building up these medications. Stronger and more consistent effects involve lowering blood sugar, greater appetite suppression, and more sustained fullness from the exogenous GLP versus our natural endogenous. So it's just a little stronger because it's higher dose. Dosed weekly or daily, depending on the medication, but typically I see patients dosed weekly. And why does this matter? People with obesity or type 2 diabetes often don't produce enough GLP-1 or their bodies don't respond well to it. So these are meant to replace and boost what the body struggles to do with on its own. So it's still based on a natural process within the body. So if someone is, I can't not state this, but if someone is utilizing a GLP-1 or GIP that is an injectable, not all are injectable. There's Rybelsus, which is the pill form. There are more digestive side effects with Rybelsus versus the other injectables, but for some individuals, needles can be very scary. So it can be bypassed. I do often see Rybelsus having a hard time getting covered, but it is an option. So safely dispose of needles. You can make your own sharps container if you are utilizing a GLP, GIP medication by utilizing a laundry detergent bottle, and you just want to make sure you label it. Use needles, and of course you can bring it to your local fire department to make sure it's disposed of properly. You want to make sure once you've used the syringe or lancet to immediately put it in that container. Make sure it's labeled extremely clear. You can write it contains sharps, especially if the people in your family and your household know what a sharps container is. But we can't assume that people know the basic lingo of that. I can't assume everybody knows that. So you could, label it, use sharps, and then also disposed of needles or used needles. You could have multiple labels on there just to make sure people are extra aware. Keep away from children, keep away from pets. Um, Screw on the top, make sure it's not just capped on. And once the container is full, consider bringing to a local fire department for proper disposal. So some brand names, of course, this is going to be distributed, but just so you're aware of the GLPs versus the GIPs, the combinations. So of course you have Victoza and Saxenda. Then the more popular that I saw after was the Ozempics, the Wegovy's, the Rybelsus. Trulicity's been around for a long time and helps a lot of diabetics. But of course, Ozempic was the first big GLP to hit the market from that is what caused a lot of this conversation, I feel. GIP receptor agonists don't exist on their own. GIP on its own is not as clinically effective, but when you combine GIP and GLP together, it mounts a very good response. So you see the naming of Manjaro, right? Manjaro sounds like mountain because it's the pinnacle. It shows the best results for weight loss because of that combination. So if someone has diabetes, Manjaro is cleared for those with diabetes. Zepbound is the one on the market I've been seeing more popularly recommended by providers and getting coverage. And I think it's also because of the results it has by combining the GLP-1 and the GIP. So some patients will utilize Ozempic or a GLP for a little bit, and maybe they hit a plateau. They're not doing maybe nutrition, or they're just really struggling. Um, and then the doctor might push them from a GLP-1 onto a combination, or they might start them on the combination. It's good to be aware of the differences that they are two different medications technically. Dosing and titration. So, why do they titrate you up slowly? So, it's to minimize GI side effects like nausea, vomiting, constipation. If someone was to increase their dosage very rapidly, it would be very uncomfortable. And they might have difficulty eating, drinking water, maintaining hydration. We want to allow the body to adjust gradually to the appetite and glucose changes. And we want to improve long-term adherence and tolerance. So if someone starts at a very high dose, the body does start to build up that tolerance. So that's why it's something more steadily escalated over time and then brought down as needed too. So tapering or stopping, there is no formal tapering protocol for these medications, but slow reduction, typically the way someone goes up is the way they go down on the medication. Um, and it's typically recommended to step down one dose level every 2 to 4 weeks. I've had patients just take themselves off of it. I don't recommend it, but some people do that. I always recommend consulting with your provider as there can be side effects. Mild, but there can be. Monitor blood glucose and weight closely after stopping if someone is titrating down, but we will get more into that. It's important to be very aware of if you are on the medication and then titrating down, what you were eating, what you were consuming, the volume, how much protein, carbs, and fat was sustaining you at your goal weight. And then when coming off the medication, it's being aware of this is how much I was taking in, this is what was helping my body. And then I have to try to really maintain this when the cravings or food noise comes back, especially if it's not thought to be very insulin or insulin resistance in nature, where the person may have an elevated weight. It might have to do with emotional eating for some, or food noise for some, because of those lack of incretin hormones. So I'm not going to spend a ton of time on here because you guys are going to have this given to you, but these are just examples of the common GLP, GIP medications, starting dosage, titration schedule, and maximum dose, depending on what you're taking and what your needs are. So functions of the glucagon-like peptide. One, this is something that you can, of course, like sit and really look into at your own leisure. But of course, some really important things to highlight is in the pancreas. It increases that insulin secretion and helps those B cells to formulate too. So part of this is thought to be that some individuals have atrophy going on of their beta cells. So it's not just that there's resistance in terms of the need for more insulin to help that sugar enter the cell to be utilized for energy. It's also that the beta cells that make the insulin are starting to atrophy and die out, and the person might not be making as much insulin just in general. So it might help that, or it does help that, I should say. Beta cell apoptosis. Apoptosis just means cell death. So it helps to prevent those beta cells from dying off, but it can also help with the formation of new ones. So that's wonderful. It reduces glucagon secretion. So glucagon raises blood sugar, insulin reduces blood sugar. So it's helping to keep us right in this nice maintained homeostasis, like we touched on in the first presentation about blood sugar balance. We don't want to be too high and we don't want to be too low. So it helps to maintain that nice homeostasis. Our heart increases glucose uptake, right? Because it's a muscle, right? It can increase heart rate because we are losing weight and metabolic rate might be going up a little bit, and does help to reduce blood pressure. Uh, for the tongue, taste and sensitivity might be a little bit more sensitive. I have some patients, they develop different aversions sometimes. The liver increases glycogen storage, so storage of some of that sugar in the liver to then be used. Adipose tissue, though, increases that glucose uptake and helps with reducing body fat cells. And of course, the GLP medications help with reducing the rate of stomach emptying. So it slows down that movement throughout the GI tract and helps you to keep fuller longer, similar to, fiber, protein, healthy fat. When combined in a proper ratio for your dietary needs, the whole point of doing that is to slow down dietary transit to make you feel fuller longer. So the GLPs are doing very good and important things, but it's mimicking what is already natural in the body that we want to do with a healthy diet. So it's just one piece of the puzzle. I like to see it as a tool in the toolkit that is used based on the individual. So, what is a GLP, a GIP, and why does it matter? So, you see here there's a diagram on the left of GLP-1 and GIP. So, this is fun to kind of sit through. But like we were saying, GIPs on its own don't are not very effective. That's why you don't see GIP medications on its own. GIP is a natural hormone released after eating, similar to GLP-1. It helps the pancreas to reduce insulin only when blood sugar rises and can play a role in fat metabolism and appetite regulation. So it's FDA approved for type 2 diabetics and widely used off-label for obesity, the GLP and GIP-1 combinations, and that's where we saw the advent of Zepbound. I just want to make sure I covered everything. Yes. Okay. So this is a nice comparison table I put together that I find to be helpful. So you have the L cells of your ileum or your colon in your large intestine. That's where the GLP-1 is secreted from. And then you have the K cells in the duodenum and the jejunum, which is in your small intestine. So that's where the GIP is released from. So those two peptides, they're released in different areas of the body. So GLP-1 is in your colon, GIP in the K cells of the small intestine. The main action of GLP-1 is to increase that insulin, reduce that glucagon, and keep appetite low. The GLP-1 has more of the slower stomach emptying compared to the GIP, which does have that, but not as extreme. The CNS, so central nervous system. So they both impact the brain. It's more so in the GLP-1 to reduce the cravings and promote satiety. There's a limited effect on appetite, but it is there a bit for the GIP. And then metabolic role supports weight loss and glycemic control, the GLP-1 much more over the GIP. So the GIP comes in to support insulin a little bit more if the person needs it. But all this medication is wonderful, I'll be honest. It does work very effectively in those who it's meant for, but nothing can be everything to everyone, right? Like there's always a catch, right? My parents always taught me if it's nothing's for free in life, So you always want to do your homework and see how things best suit you. So it can take time to titrate up. That's not really a big barrier, though. I think that's actually a good thing. Long-term effects on fat metabolism is still being studied. So I do see a lot of rebound if someone is not taking the medication with the mindset of, I want to change my lifestyle. I want to make changes in my routine. I want to be the best person that I can be to support my health. It is not often effective if someone's like, I'm very overwhelmed. I don't want to do diet right now. I'm not open to it. I just want to take a medication and call it a day. Um, it doesn't, it only works as long as you're on it. So of course, when people come off of it, there are talks of microdosing, individuals, but that's still very new. So the big thing is that the person, if they're on this medication, they can be on it for a long term. I've had someone take Monjaro for almost 2, 3 years. Their providers had them on it and doing well. So it is very individualized, but understanding that when people do come off of it, the cravings can come back. So we want to mitigate that as best we can. Who should not take a GLP-1 or GIP medication? Anybody with personal or family history of medullary thyroid cancer, history of multiple endocrine neoplasia type 2. It's a rare genetic condition, but it's worth to discuss. Currently pregnant or breastfeeding has not been approved yet for that area of longer lifespan. If anyone has diabetes and has been diagnosed with gastroparesis which is already where the digestion is very slowly moving and almost stagnated for some. You don't want to exacerbate that more. Active gallbladder disease, of course, because it's that slow motility. If things are moving slow, it can move slow through the gallbladder and cause risk for blockages. History of pancreatitis, allergy to, of course, the medication, and if you have not tried lifestyle change. So I do think it is not something for someone who hasn't tried lifestyle change. I think it's always worth it to try and fail, but truly trying and failing. I mean, working with maybe a registered dietitian if someone has not already, to see if there's any, spots within the diet or lifestyle that could be accidentally getting glossed over that could really make a big impact and, prevent you from having to go to the doctor at least once a month, get the shots, have to inject yourself. That if you can do it the natural way, that's a blessing. Why not? But nothing can be everything to everyone. So, like we were saying, the GIP medications don't account for the nausea, constipation, sometimes all of these, it depends on the individual, but very common I see nausea and constipation with individuals taking these medications. So that's the two side effects I really hone a lot in on. Fatigue, especially if someone's not able to eat enough or get in their basic needs, muscle loss. If you don't take in protein, your body needs it and can't make it from other things. So if you don't have it, you lose it. Your body eats your muscle because that's your storage form of your protein. So if you don't eat it, it withers away because it has to be used. Your body is always breaking down and building protein, often synonymously at the same time, meaning my body could be breaking down protein from the musculature in my intestines to help make enzymes to break down food. But also in the same instance, I could be digesting food and absorbing it to then make protein at the same time to help build up skeletal muscle. So metabolic processes are not going on in a petri dish in our body. You could have multiple processes going on at one time, but at the end of the day, if you don't take in enough protein and your body needs it, it will break it down from what you already have in your body. And muscle is the foundation, the fountain of youth, and is correlated with longer lifespans, independence, and a greater health span. So I would hate for someone to take the medication to just reduce their weight, and the weight that they do lose is muscle, and then therefore after having done it, they're actually metabolically older. Um, Hair loss, skin, nail changes can happen when someone's losing weight. Those are the last areas of our body to really be prioritized for nutrients. Internal comes first. Um, and of course, access and affordability, or for some individuals, it doesn't work, but more often it does work than not. You want to use caution if you have kidney problems. So if you have kidney failure of some degree that you need to have a lot of water, a lot of times individuals have a hard time getting enough water in because they feel full or nauseous. There's a lot of strategies to mitigate this. But if someone is already at risk for dehydration, especially with vomiting and has kidney problems, it's can be risky. Not approved or well studied in type 1 diabetics. If someone is of older age, and they already are low muscle tone or have osteopenia, they might not be a good candidate for these medications. And by older age, I mean an individual in their 80s or 90s who might be overweight or have out of control blood sugars. History of an eating disorder, of course, can worsen restriction in those individuals. So it is truly a case by case basis. It can't just be peddled by a doctor that doesn't know you online. That's not, I don't want to say that meets you for 5 minutes. Like you really, if you're going to go on this medication, you really want to sit with the provider. They should get to know you, your lifestyle, what you're doing, what you're sleeping, your stress, what you're eating, what you've tried to do, what you haven't done, and put together the pieces of your family history, your personal history, your insurance, what's affordable. There's a lot of moving pieces that makes this very individualized. So the impact though, and the importance of these medications to understand as well. Current snapshot is as of 2023, 42% of US adults meet the criteria of obesity, which is a BMI greater than 30. Yes, BMI is not always the greatest metric. However, a BMI greater than 30 is often not all muscle. And nearly 74% are considered to be overweight or obese. So if someone has a BMI of 26, but they're all muscle, and as a woman, their body fat's under 28%, that's not really a big deal. But that's why I don't really like using BMI, but this is how it's gets reported just from a public health standpoint. It's an easy reporting tool. But we are seeing our country is getting more and more overweight and metabolically ill. We're not becoming overweight because we're overmuscular. If anything, we're undermuscular in this country, unfortunately. Undermuscular and too much adipose tissue or fat tissue. Childhood obesity rates remain high at about 20%. Um, it's cool to see though that the rates are overall like they're not peaking as fast as they were. They're starting to kind of plateau off. I think because of these medications and a lot more tools. I think access for registered dietitians like today, where there's a greater expanse in insurance coverage in the last 5 years of getting access for people. So I think that's part of where we're starting to see this plateau a bit, but it's still a concern. And clearly, there's an issue going on systematically to help people get what they need. So I do think overall this can be a great tool. Now we're going to move a little bit more into managing the digestive side effects, and then we'll move, of course, into the musculature, the fatigue, how to really hit your goals while you're on this medication. So digestive side effects. So general gut health tips, right, are always good to follow while taking this medication or just in general by trying to focus on what you can tolerate from prebiotic fibers like onions, leeks, oats, and asparagus. Prebiotics is like a fiber source that becomes the food for that bacteria. So we want that healthy bacteria that helps to create those incretin hormones, right? We want a healthy gut with lots of variety of different good bacteria in there to offset the bad bacteria. So those foods help to keep them happy and feed them and let them further develop. Probiotic foods, yogurt, kefir, kimchi, sauerkraut. So those are foods that already contain live strains of bacteria that you're just introducing to the gut. And we want to balance fiber intake during dose increases to avoid GI distress. So when we're titrating medications up or down, sometimes different the fiber can impact people. So for some individuals, even though fiber is really great for a healthy gut, as your motility is slowing and you're increasing your dosage more and more steadily, you might want to use caution around how much fiber you have on, say, injection days. And maybe you would focus on having a little bit more fiber as that injection kind of starts to wear off. So if you inject on a Friday, Monday, Tuesday, Wednesday, Thursday are going to be easier days to take in more protein and more fiber versus, say, Saturday. The nausea is very common. So nausea can be associated with dehydration, but nausea can be associated with the slow stomach emptying as well. So you want to stay hydrated. You want small sips of water, no big gulps, because things are not moving that fast. You don't want that really sitting in your stomach too long, making you feel uneasy. You want to try to eat every 2 to 4 hours because similar to bariatric surgery, right? Like we can't take in a lot at one time. So instead, we have to eat a smaller amount and spread it out throughout the day of healthy foods so that we can absorb the nutrients that we need, but not take in too much and get nauseous and feel sick. Um, it's a good idea to start each day if you're getting a lot of nausea with a warmer, like a room temperature water, maybe like a pinch of sea salt and some lemon, a protein-rich breakfast with some scrambled eggs, spinach, or a chia protein smoothie. You want to really give your body a good kickstart for the day and try to make sure you're having breakfast. Sip ginger tea or chew the gingin sucking candies for 15 minutes to calm nausea if that's occurring as well. I really love ginger tea for that. Fullness, like we said, small, frequent meals if you're feeling overtly full. Walking after meals can help that motility, but also further help blood sugars if that's your target. Want to eat slow. I know sometimes if I haven't eaten for a while, I can eat really fast like a Gabon. I've got to be aware of my surroundings, no TV on, not, no on the phone, no distractions to take my time and attention off of the food. Because when my time and attention goes onto the screen, the laptop, the phone, whatever, I'm not truly tasting and being present and enjoying that meal. And people can tend to eat faster when that happens. It's very common. Seated and distraction free when eating. So it allows you to rest and digest. How many of us are on the go, eating something quick in the car, or standing over the counter? You're not letting your digestive tract really rest and digest. It can still be more in that fight or flight. And when our body is more in that stress state, that's already going to slow digestion on top of the medication as is. So then you might be, if you're already experiencing that side effect, that can amplify that side effect. Constipation, extremely common. We start to see in those higher titrated doses. So you want to increase fiber gradually when you're doing this, especially if you're someone that doesn't have a lot of fiber already in the diet. It's very common. 11 grams is the average amount of fiber that most Americans get, when women need at least about 28 grams per day and men need at least about 25 grams of fiber per day. So if we might be starting in a lower fiber spot and starting the medication at the same time, but still want to focus in on our diet, you want to gradually build up that fiber because those muscles along the colon, it's like weight training. Think of the fiber like the dumbbell. If I go and pick up a 35-pound dumbbell and expect myself to do a bicep curl if I've never done that before, that's going to be painful. I'm not going to be able to do it. But if I build up, steadily over time, okay, now those muscles along the colon are building up that strength to gradually help to propel and move that food through. And like we said, with constipation, you do need fiber to help keep things moving. But if someone is doing maybe too much fiber all the time of certain types of fibers, that could be more bulking. So you want to have a variety of different types of fibers in your diet. You get different types of fibers from different vegetables, different fruits, nuts and seeds, whole grains, beans and legumes. So that's part why you do want to have variety in your diet, because then you'll get different forms of fiber. Some help to add bulk to the stool, some speed up digestion, some slows down digestion. It's very good to have a variety of fibers in the diet, which also helps to feed the variety of flora in your intestines, meaning the variety of bacteria that we want in our intestines. We want diversity of healthy bacteria. Of course, hydration goes hand in hand with fiber and constipation. So you want to make sure you're drinking plenty of water to help usher and move that through, especially if you're steadily increasing your fiber. That will also help give those muscles in the colon a little extra hand. Liquid magnesium citrate can be really helpful. People take the pill form. That's also helpful too, but I find a little more success with the liquid form when it's more of like a urgent need. And if you're extremely backed up, of course, you can do castor oil, digestive massages, warming, like heating pad. You could do yoga with different bending and twisting. But if you're really, really blocked up, I do like to recommend a stool softener and a laxative. So God forbid, you don't want to have a laxative of a very dry stool and push that through and cause other issues and discomfort for the individual. So there's a list of things that someone can try if they're experiencing constipation on this medication. And constipation makes perfect sense because you are slowing digestive motility on this medication. So constipation, bloating can go hand in hand with that if it's not planned for and treated accordingly. And monitoring. Keeping a symptom journal can be really helpful. Monitoring thyroid markers could also be helpful. So if someone has hypothyroidism, that also can slow down the rate of digestion in the body, as the thyroid controls the rate of most things in our body, including our heart rate, for example, our metabolic rate, the rate of digestion, to name a few. So of course, checking your thyroid before going on this medication can be helpful. ESR is a lab that you use to test for intestinal inflammation. So, gut health and gut abnormalities are very common. So, if someone does have already leaky gut, or the more professional term is increased gut permeability, it would be good to be aware of what's going on in the gut before going on the medication. Because sometimes fixing the gut helps weight loss and the person might not really need the medication, or if they do go on the medication, they might experience a lot of discomfort. So you want to, take care of that intestinal inflammation that might be going on before they even go on the medication, so that they don't have to experience that pain and discomfort. So when we are talking about slowing down when eating, I just love this graphic to have on the table printed, even if you just do it for a week, just to put it on your mind and imprint it on your mind. It has a bunch of just good visual tips just to remind us, all things that probably we know, but it's just hey, gentle reminder, make sure we're doing this at meals so that we could slow down and really savor and taste our meals too. When you're taking that time to really chew it down, it's preventing these large particles from getting passed through into the GI tract. And if you have larger pieces that aren't really chewed down or broken down as well, that could also cause some bloating and discomfort and slower movement. Acid reflux can be common with slower motility. The food is not emptying and sloughing off from the stomach into the small intestine as quickly, especially if someone eats, a bigger portion and that's just sitting there, right? If you're more prone for acid reflux, of course, try to avoid spicy foods, acidic foods, fried foods, chocolate, especially right before bed, lots of caffeine, alcohol. You will see it says often if you look up acid reflux, like low fat foods. I wouldn't say it's the olive oil, but I would say it's like the more saturated fat food. So fat from an animal. So like dairy fat, think of mozzarella, think of fried foods, that's high fat. Think of course, like takeout, pre-prepared things. So we want to eat small and eat slow to help control acid reflux. So a lot of this is very multiple birds, one stone, right? Eat slow, more frequent meals, and you'll reduce a lot of the digestive discomfort that we're talking about. Stay upright after eating, about 2, 3 hours before laying down, which is good. We should stop eating at least 2 hours before bed. Limit carbonated beverages, even seltzer. I know seltzer's not the devil, but sometimes the bubbling and the carbonation can really impact reflux. Bland, low fat meals can be helpful, especially if it's around injection day or the day or two after injection day. And then afterwards, your motility is a little bit, more manageable. Then you would go, off the more blander foods. But again, this is very individualized. I don't see so much of the acid reflux as much. Of course, people take Tums. Papaya enzyme is another option that people can try to take too. And we want to consider medication timing, that if you um, inject away from large meals to reduce reflux flares, like we were saying. Hydration. So, because people are feeling overtly full, sometimes, not sometimes, often I see with the higher doses, they're not drinking as much water just because they feel maybe a little nauseous when they drink a lot of water. So, water is so important for our health. It provides joint lubrication, including your spine and your neck for those who have different back pains and abnormalities. It delivers nutrients to cells. When we're hydrated, it helps to reduce risk for infection, especially in the winter months like cold and flu, COVID, improves cognition and mood because our brain literally shrinks when we're dehydrated. Of course, it can protect your heart. It doesn't have to pump as hard, it doesn't have to work as hard to send a smaller amount of water throughout the body. If there's more water, the heart doesn't have to pump as frequently. It can help blood pressure, reduce headaches, helps to reduce blood sugar because it could help you to pee it out, urinate it out. Regulation of digestion. Sometimes our hypothalamus plays tricks on us, meaning if your hypothalamus tells you you're hungry, you're tired, and you're full. So, or you're hungry, tired, and thirsty, my apologies. So sometimes we could be dehydrated and why am I so snacky? Why do I keep grabbing these foods? Signals kind of get crossed and like, let me just check and see if I'm actually just really thirsty and dehydrated. Um, Not all of us have a very strong thirst mechanism. So just being aware of your own personal body signals is important. Like I know I don't have a thirst mechanism unless I'm working out or really hot. So I have to keep a beverage in front of me and I have to tell myself to drink and have certain time points throughout the day that I just make sure I have X amount of water done. And I take responsibility for my hydration in that regard because my body doesn't really tell me. Improved energy, right? Because food and nutrients are getting more delivered appropriately throughout the body, greater circulation, weight management. So if you're dehydrated, you will not lose weight. You lose weight by or body fat by breathing it out, sweating it out, and peeing it out in the form of liquids. So if you're dehydrated, it's not really moving through you and helping with the process of lipolysis. Of course, if you're prone for kidney stones, it's important for reducing that risk, gallbladder stones, detoxification, athletic performance. You need water is so, so important. Just because you don't feel thirsty or you think you're not feeling the effects of it, it does count against you. Am I drinking enough water? I tormented my older father one time because he drinks no water, and he's a fireman. And I printed this little graphic I made and I just stuck it in the bathroom. That's all I did. Just put it in the bathroom because they would do that to us as athletes at school and in college. So it makes you aware. You check, the color and you say, okay, if it's a one or a two on the upper end, all right, I'm okay. I'm pretty hydrated. You want your urine to be a pale straw or clear. You don't want to be clear 3, 4, 5 times in a row because you could be oversaturating your electrolytes. You could add electrolytes based on your fluid needs and your goals. Um, However, pale straw is a great color to find, so clear is not always ideal per se, pale straw. However, if you're seeing 3 or 4 and on, it can tell you how much water you really should be taking in. So if you're seeing any yellow, try to have 1 to 2 glasses of water at least. If you're seeing darker, yes, that does exist. Please just chug 3 glasses of water. I'm kidding. If you're on the medication, though, that could be a little problematic. So you just want to try to sip, catch up. This is where electrolytes can be really helpful to reduce risk for dehydration. Some electrolytes are also flavored, so it might help to entice drinking, but we want to really prevent gulping beverages and especially gulps, large gulps with meals with food. You want to take small sips with food to help coat the esophagus, help the food moisten so it could help transit, but you don't want to be, and I don't like using this word, but like we don't want to be like chugging glasses of water with our meal because it can make you feel really full or nauseous and it actually hinder your ability to get in enough protein at that meal, your fiber, your vegetables at that meal because now you're feeling overtly full from the water, which I get it, we want to be in a calorie deficit, but we also don't want to be nutritionally depleted either. Um, Other dehydration risks, though, um, of course, it's the summer. So, and especially if you're trying to pair activity with the GLP GIP medication, we'd be silly to not focus on this. Ideally, half our body weight in fluid ounces is what our total water should be, or at least a bottle of water for every hour of physical activity, at least. Bone broth can be a really great tool when on a GLP GIP medication because it's, protein, it's about 10 grams of protein per cup. It does give you some salt though. The Kirkland one, Kirkland Organic has some of the least amount of salt I've seen in any bone broths. It gives you protein, it can hydrate you, can give you some electrolytes. Just be aware of the sodium. Kettle Fire has a lot of herbs and spices in it too, so it can be very anti-inflammatory, but also if you have acid reflux, just to be aware. And like we were saying, sip throughout the day. If you're like me, that you don't get that mechanism, your body doesn't really tell you, setting alerts can be really helpful. The My Water app can be really helpful. The kids at the university used to love Plant Nanny, which was like an app that looked like Tamagotchi. And if you didn't fill in your water, you'd kill your plant. But if you did fill in your water, it was like happy and growing. So it's cute. It depends on, what you like, but that could be an awesome tool. Of course, a general food tracking app like Chronometer, Practice Better, um, MyFitnessPal, you can track your water and create streaks for yourself to create a little incentive. Um, I like to recommend a sport cap or a straw to help just entice the accessibility of the water. And when my patients come into session and they don't have a water bottle with them, I'm kind of like, if you're not bringing a water bottle to this session, then do you bring a water bottle other places with you? It should be keys, phone, wallet, water when you walk out. Um, so like we said, track your hydration, recognize severe signs if you're feeling lightheaded, woozy, seeing black, lips are dry, nauseous, throwing up. It's really important to um, be aware, dizziness, confusion, pay attention to your loved ones, pay attention to your dogs. We're hitting the dog days of summer soon. Hydration alternatives. Herbal teas can contribute to hydration. Just want to be careful if you're on any other medications that could contraindicate. Um, or infused water, you could take frozen fruit and herbs and put that in water to help flavor it. Of course, the electrolytes, like I said, and set daily hydration goals. If you normally drink 2 or 4 glasses of water a day, can we get to 4 to 6 glasses? We don't want to jump up to 8 or 10 glasses if we're at two. Like we want to create realistic goals and we want to gradually phase things up. Understanding fatigue. So, fatigue can come about from dehydration or lack of electrolytes. Nutritional deficiencies. So, when we are on these medications, it is important, especially when you're working with a registered dietitian, if they feel you're not eating enough, to check in on your B12, your iron, your thyroid, other markers to make sure that we're not depleted. Of course, when you're utilizing a body composition scale, you can measure your muscle mass as well. Helping with fatigue too. Some people try to intermittent fast. I would not intermittent fast on this medication. You want to try to eat every 2 to 4 hours. You want to try to stop eating 2 to 4 hours before bed. So if you're eating every 2 to 4 hours, you're getting consistent energy put into your body, consistent amino acids, consistent glucose to help your body remain fueled. And if you are eating and you're on a higher titration dose and you are trying to eat like one big meal a day, it's going to be very hard to have your nutritional needs met. The amount of protein that you need for the day alone or the fiber alone, the person is often way too full. Even with just 2 meals, the person is often way too full, dividing their protein, just their fiber in between 2 meals. So at least 3 meals per day. If you're very prone to the nausea, fatigue, constipation, try to spread it out 2 to 4 hours. The stop eating before bed, 2 to 4 hours. You want to let your heart rate drop before bed. Your heart rate going up is a sign your body is working. And we want our body to start to prepare for sleep and to rest. So if our body is consuming food and trying to extract nutrients and digest food that we had maybe 2 hours, an hour before bed, then 2 hours is a good mark. 4 hours is even better. But if you have food and then go lay down, that digestive tract has to still work to break that down. So your body's working when it needs to be resting. That can also impact fatigue because then we're not as likely to get REM sleep or as deep of a sleep. Physical activity, we want to use caution. So if someone's extremely depleted nutritionally, we don't want to ask them to vigorously exercise. But if they're not depleted, they're in a good spot, and maybe not maybe but exercise can be a good tool for releasing endorphins and actually can help to give a little bit more energy throughout the day for some people. So regular moderate exercise like walking can actually help our energy. I'll never forget, I got my mom going to the gym and she was like, I'm so tired, like I don't have time. When I get home, I'm just like shot from work. I can't picture myself going to the gym and just getting more shot. And I said, well, just try it. Just go once. And like we went together. She came and she's like, "Oh, I have so much more energy. I was able to get this done and get that done, cook dinner, yada yada." Um, but if you're leaving your workout feeling so spent that you just go home, eat, shower, and crash, you could be overdoing it. So it's good to check in with a dietitian and a personal trainer sometimes just to make sure everything is, moving the right direction for you. Supplement support. If you are depleted and fatigued, especially if you're eating under 1,200 calories a day. Most people, it's very rare to find someone that needs less than 1,200 calories a day. Um, but a multivitamin is really important, especially if you're having at least like meal skipping go on. Magnesium can also help a little bit with this. Magnesium is needed in over 500 metabolic reactions. I would do more of a magnesium complex with like a citrate, a glycinate, maybe a malate form together, a B complex, but you can run the labs and see if someone needs some of those nutrients. Hair, skin, and nail care. Like we were saying earlier, our hair, skin, and nails are going to be the last to get the support. Our body's going to prioritize that last. So if you're nutritionally depleted, you could see hair loss. So of course, protein between 1.2 and 1.6 grams per kilogram per day. For most women, that's about 20 to 30 grams per meal. For most men, it's typically about 30 to 40 grams of protein per meal. Nutrients that can help to support hair, skin, and nail include biotin, zinc, collagen, omega-3s. But you want to monitor someone's ferritin, like their iron levels, their B12, their vitamin D, their hormones, their thyroid. There's a lot of things that can cause hair loss. So it's important to look into it. But typically when someone's on a GLP, it's more so related to the weight loss that they're experiencing. due to the caloric restriction. Psychological stress, though, can bring it on. Higher cortisol impacts your thyroid. So that can greater impact hair loss. Muscle and bone. So as we lose weight, if you are in a calorie deficit, but you are also in a deficit from protein, right? Because you could be in a calorie deficit, but not a protein deficit, right? Meaning that you're taking your calories and reducing them from carbs and fat while keeping your protein high. That can help reduce the risk of muscle loss. So, eating a protein surplus, drinking plenty of water to help that protein get moved and flushed through the body, and important to be aware that there is risk for bone and muscle loss or lean body mass loss. So we like to utilize the InBody scale at Functional Nutrition to measure your muscle loss, body fat loss, visceral fat, to truly track your progress. If you're someone that's at risk for bone loss, osteopenia, osteoporosis, this medication might not be the best for you. But to mitigate that, right, you could do a DEXA scan just to know where you are before, to be able to track it for after, a year after. You want to engage in regular physical activity, like strength training 2 to 3 times a week. That will help preserve the bone and the muscle. Each body part, ideal is to train at least 2 times a week. Um, Rebounding or some bone specific nutrients. Some people do different exercises like jumping on a trampoline or jumping rope. I like the weighted vest when walking as a way to help improve bone health. For a lot of women, I see a range of about 15 to 25 pounds. Men, I'm seeing ranges between 20 and above. Uh, and of course, nutritional support to really help manage muscle and bone loss. You want to make sure for bone, there's a lot of nutrients for bone, but the basics is calcium, vitamin D, vitamin K, magnesium. You want to make sure you're getting that in your diet or supplement form, especially if you're at risk for osteopenia and osteoporosis. And then, of course, adequate protein intake for both your bone and your muscle. Titration tips. We tapped a lot on these like when earlier when we first touched on titration, but when you're first titrating up and increasing that dosage steadily, you want to support protein like we were saying and resistance training to mitigate that lean mass loss as your appetite reduces and the amount of protein you can take in reduces. We want to prevent nutrient deficiencies, manage GI symptoms with small meals, stable hydration, avoid overtly high processed fats or very high fiber foods during that titration, especially if you're more sensitive to nausea and constipation. We want to monitor muscle, bone, and function, meaning if you're working out and you were working out before, are you still able to do the same things that you were doing? So if you were squatting or deadlifting or lunging or doing bicep curls, that you're still utilizing the same weight or more than you were in the past, healthfully, safely, with great form. Tapering and holding dose adjustments, there really is no strict protocol with a lot of this. So that was the general dosing I provided before, but I have some individuals that maybe they don't build up a tolerance at a 1.7 for a while and they hold on that for maybe, a month or two, and then eventually they can go up in dosage. So it can be individualized. I've had patients work with their providers from a team mindset. I do feel the team strategy is best with these medications versus the old school parenteral model of the provider I'm telling you mindset, where a lot of individuals will tell their provider, hey, I'm taking this dosage, it's making me feel full, it's holding me over it, I'm still seeing weight loss, it's not plateaued yet, can I stay on this dosage? And then, the doctor would give their educated opinion, and then they would come together as a team to make a best, solution. So there is that communicative dynamic, and I always encourage that between the provider and the patient. And of course, you want to continue structured eating, even if at that tapered, reduced dose, just to make sure that you're sustaining nutrient intake and minimizing weight regain. So what you were eating when you were on that higher dose and maintaining a healthy weight, maybe building muscle or not losing muscle, but losing weight and maintaining muscle is still a great win. So you look at what you were eating at that time and try to keep that mimicked as you taper down. With titration tips, when you're going up, you start at a low dose and typically increase every 4 weeks to minimize GI side effects. Um, a lot of this we've already stated. I like to also recommend that you guys consider the day of the week that you inject. Just that for some individuals, if they catch that they're, maybe more prone for like binging episodes on a Friday because they get out of work and they're blowing off stress of the week and they're celebrating that they don't, have work for a couple days. It's often psychosomatic. But um, some individuals will choose to do their injection then, and it keeps their appetite more at bay for Friday, Saturday, Sunday. And then they have more of their appetite during the work week when they have more of a routine and it's easier for them to maintain that structure. So it is something to consider, especially if there's certain days of the week that you can eat more on certain days versus other days. And when you're injecting, maybe you're injecting on a day that you have more time to eat and have structured meal timing. Um, but unfortunately, you're so full that you really can't utilize that time. And then later in the week, you don't have time, but you have an appetite. So you might want to adjust it based on what is as free in your work week. Easy ways to get enough protein, even with a low appetite. So, like we were saying, break into small portions. So, if you do 2 ounces of, say, chicken at lunch, and then you maybe, or 3 ounces at lunch versus 6 ounces, say, and then, mid-afternoon snack, you do a little tuna salad with some simple Mills crackers and some celery. And then at dinner, you do another, 3 ounces of, say, turkey, ground turkey, you can do ground turkey tacos with some beans, and you're just breaking it up into smaller meals. If you can tolerate it, try to aim for at least 25 to 30 grams of protein per meal at minimum. Prioritize easy to digest options if you're feeling nauseous or full, like chicken, lean turkey versus higher fat, strip steak or lamb, say. Lean fish can be easy, especially if it doesn't make you feel queasy, and it's a great way to get iodine in. Um, Bone broth, like I said, is another great tool to help get your protein in. The little turkey jerkies or chicken jerkies, I like them because they're lower in saturated fat. The Chomps turkey jerky is about 12 grams of protein and 80 calories. So tiny, dense, but not overtly filling. Smoothies or liquid protein shakes or bars can also be good tools when you're feeling really full. There's also other products that are starting to come more on the market, like the Ascent Clear Protein Whey Isolate, this that I'm holding up here. So this guy is interesting because it is still like a clear powder, similar to almost like your collagen peptides that you can add into coffee or tea. Another easy way to boost up protein, synthetic though. Um, is this, if you don't like regular vanilla or chocolate, this flavor is like a pineapple coconut, and you can just put it into water and sip it throughout the day. So that can also be an easy tool. I think it's a mango pineapple flavor as well made by Ascent. I do really like the Ascent brand, not just because it's very easily accessible, it's affordable, but most importantly, it's clean. Um, it has stevia, but no sucralose, which is amazing. I see a lot of sucralose and a lot of protein powders. And the regular vanilla protein powder has a good balance of BCAAs too to help with maintaining good musculature. On the right, you can see some meal ideas that are about 20 to 30 grams of protein. So eggs, like hard-boiled eggs, egg whites are great tools. Yogurt, kefir. Kefir is like a liquid yogurt. It's like a fermented milk that you could add into oatmeal or smoothies to add a probiotic, a little boost of protein if you'd like. Lentils or beans, I like to recommend if you tolerate that fiber as like a healthy starch side with your chicken or your turkey, so you're not just getting the protein from that animal protein, but also with your side. Protein smoothies. I love doing, 2 fruits in there. So you're getting some electrolytes, like a half a banana and about 3/4 cup of berries, plus some protein powder, maybe a little kefir or a dollop of Greek yogurt or cottage cheese to boost that protein up. A cup of cottage cheese, about 30 grams of protein. You could also add a little almond milk into that smoothie that we have here, chia seeds, flax seeds for a little fiber as well, and a mild boost of a very moderate boost of protein. And maybe some greens if you can tolerate, like some spinach, and really blend that up well. And you could sip that, and that might be a little easier to tolerate. Or you could turn it into a smoothie bowl and pour it into a bowl and put a little granola, unsweetened coconut on top. So maybe save the berries from blending it in. You just blend the banana and then you put the berries on top, or vice versa. There's a lot of options. Some other snack options you could do is edamame, depending on your estrogen status. Edamame is soy, but it is a protein and a vegetable. Dry roasted chickpeas can also be a moderate protein source. And same with hummus, or if you tolerate from a dairy standpoint, string cheese. I love the little blue baby Belch cheeses. So some strategies to help combat that fatigue and loss of body mass, loss of lean body mass, is of course to hydrate well and consider electrolytes. Incorporate balanced snacks like nuts with fruit to sustain energy. Regularly check lab results to monitor energy related medication effects. So I like to run labs every 6 months for individuals. If they're really working on something aggressively, every 3 to 6 months. You want to still eat every 2 to 4 hours if you haven't gotten that message from me yet. Prioritize restful sleep by establishing a calming bedtime routine. So if you're getting rested sleep, that can also help build muscle, especially if you are weight training. And stay active with light exercise to help increase overall vitality and at least help to maintain that lean body mass, that muscle mass. This is the Mediterranean diet pyramid. So this pyramid I like as a better version compared to that old school USDA pyramid that got replaced with My Plate, which My Plate is a great tool too. I just think this is a wonderful visual to see that movement, enjoying a meal with others, that Mediterranean family meal table is the base. As you move up, the majority of the foods you take in should be plants. So that's what they're demonstrating here is fruits, vegetables, whole grains, beans and legumes, nuts and seeds, herbs and spices, extra virgin olive oil. The common denominator between all of these is fiber pretty much, except for the olive oil and the fact that they're all plants. Next, you move up towards fish and seafood as a ideal predominant protein, especially shrimp. It's a myth that shrimp contributes so much to elevating cholesterol. There is a little bit of dietary cholesterol in shrimp, but dietary cholesterol is not a direct correlation with serum cholesterol. It has a small effect, but not as much as sugar, saturated fat, stress, family history, lack of fiber, lack of water. There's other factors that play a bigger part. Inflammation, insulin resistance. So, seafood is wonderful to have. It's a great lean protein, it's easy to digest. Shrimp is another great, easy protein snack. You have a shrimp cocktail ring in the fridge, have a few of those as a little snack when you come home from work, maybe an apple or something. Great snack. Poultry, so I like to say aim for animals that swim, fly, or grow from the ground. So let's pretend that chickens and turkeys fly. It does say dairy here, like cheese, Greek yogurt. So think of dairy as being more of like your yogurts, your cottage cheeses, your sharp cheeses, or your hard cheeses like your Locatelli, your Romano, your sharp cheddar, or your feta cheese too. Um, we're not recommending a lot of the high fat mozzarella, unfortunately, or glasses of whole milk. Ideally, is like an almond, unsweetened coconut, pistachio, milk of some kind, hemp milk, etc. And then red meat and sweets, they're not omitted, not allowed when we're taking a GLP, GIP medication, but you just want to keep it to a minimum. This was that stepping up to the plate diagram that we went over last session. So of course it's a mimic on that USDA My Plate where we want to make half of our plate vegetables, 1/4 a starch, which could be, ideally a starchy vegetable, peas, corn, potatoes, sweet potatoes, most squash, whole grains, right? That can go in this category. And then you have your lean protein, which would be the other 1/4. Like we said, swims, flies, or grows from the ground. And then ideally half your plate is, non-starchy vegetables. So those are all the vegetables I didn't say. So those are all vegetables except for peas, corn, potatoes, sweet potatoes, and most squash. The squash that gets the asterisks is like zucchini, summer squash, spaghetti squash. Those guys are more non-starchy. You can eat as much as you'd like, and that would go in this one half of your plate section. Other ways to naturally increase GLP-1 in the colon is to eat plenty of fiber-rich foods, like we were saying. We want to increase that good bacteria. We want to increase the food for it to thrive. So let's give it the fiber it needs to let it eat and let it grow. We want to include healthy fats like avocados, nuts, seeds, olive oil. They can stimulate more of that GLP-1 release to make you feel full. Fermented foods, like we were saying, they can support gut health and that L cell function that helps to release that GLP-1. So fermented foods like sauerkraut, kimchi, kombucha, yogurt, and even cottage cheese is fermented too. Um, Exercise can also help improve GLP-1 sensitivity. It also is recommended to avoid ultra-processed carbohydrates and high sugar loads, which can blunt the response of GLP-1 in your body naturally over time. So the bonus tip is that GLP-1 is readily broken down in the body by the enzyme DPP4, which we had talked about, hence why we have to titrate up. So that's why you might see with some diabetes medications that maybe some have tried and failed before coming onto this medication. That's like Januvia, for example. It helps to preserve the GLP-1 longer in the body. So some people will be put on a Januvia and a GLP or GIP combination just for better effects. So with today's presentation, I am going to send you guys a packet with just some recipes that you could see being scrolled through in the video on this slide. So that will be attached to today's email recap with the recording. Weight plateaus can be common on this medication. So we want to reevaluate when this happens, how much protein, how much calories am I taking in on average, what's my day-to-day routine, and I got to be honest with myself because there's knowing and then there's doing. So I run into a lot of individuals that are like, I drink plenty of water. And I go, do you drink plenty of water every day though? Like, what does that mean? Like how consistent are we, right? Do we get enough protein some days of the week? Are we in a deficit some days of the week with our calories? Are we aware some days and unaware other days? So I think it's ensuring accuracy and awareness, right, is the cornerstone there. We can always track our nutrient intake with a chronometer or working with a dietitian, telling the dietitian what you're eating, and we could figure out loosely about how much you're taking in based on the information that we're provided. And then we want to monitor hydration levels. Like we said, if we're dehydrated, when we lose body fat, we breathe it out, we sweat it out, we pee it out. So if we're dehydrated, it's not moving out. We want to consider, of course, working with a registered dietitian or personal trainer for hitting a plateau and we're really, really stuck and it's not moving. That's what we're here for. That's what we do. And of course, like we said, this presentation is covered by insurance for most individuals. And if we do take your insurance for this presentation, we often will be able to take your insurance for one-on-one nutrition counseling, which nothing in life is free, and yet I'm still dumbfounded how there's no copay, no nothing for most insurances for medical nutrition counseling. I think where nothing's free is you got to put the work in. We all do, right? So take advantage of it. It never was this well covered in the past, and let's use it now. If you got it, use it. You're paying for the insurance anyway. So and it doesn't hurt, right? Like going is never gonna be a detriment to you. And if you go and you're like, I don't know if this is for me, it's always good just to try something out and be open and honest and vulnerable with the professional that you're working with. And you could say, I don't know if this is for me. And they could, work with you and see what your needs are and how they could be met. Body composition versus weight loss. So I've had a lot of people say to me over the years working, oh, I'm at such a plateau. And I go, what do you mean by that? Oh, I weigh myself every morning and nothing's changing. I go, but are your clothes fitting better? Yes. Is my waist circumference going down? Yes. Okay, let's use the body comp scale because sometimes you could be gaining muscle and losing body fat. and not really seeing a loss weight wise. So you want to know what's going on from a body composition standpoint. Sometimes weight plateaus, you see a lot of that in July. July is insidious Christmas, I think, because the holiday season, a lot of people want to use as like, not want to, but it can be a barrier, is what I should say. July, I feel like there's even more social stuff that goes on versus December. So you just want to be aware and holding ourselves accountable. Am I eating really well Monday through Friday, but letting loose on the weekends, not, taking in a bunch of just different beverages that are adding up or foods I don't know what's in it. Large portions, not sleeping well, social jet lag, just being aware and realistic with ourselves. And we're not good or bad based on what we're doing. It's just saying objectively what's going on and just being problem and solution oriented. Add or adjust resistance training. So if someone's plateauing and they're not resistance training, this is often when we have the conversation of the need to resistance train. The resistance training is helpful for weight loss in the standpoint of the more muscle you have on your body, the greater your metabolic rate is, the more calories you need just to sustain that tissue. And with weight training, it can be good at helping to preserve that metabolic rate and help with longer lasting weight loss. You want to evaluate sleep, stress, hydration, and consistency. If I could highlight one bullet, that would be it. So if someone's hitting a plateau and they're only sleeping 4 hours a night, I'm going to circle and underline that sleep time and really want to focus in on evening routine, trying to add at least 1 hour of sleep per day, etc. I think sleep is the unsung hero. And of course, you want to normalize maintenance. Maybe someone lost 10 pounds or 15 pounds. Sometimes it's good just to hold there for a little bit, for a month, month and a half, and just maintain that and then keep pushing forward. So holding weight can be a win. It's not failure. So it's also looking at the individual situation. Food noise is a very common barrier way. I see a lot of people going on the GLP medications. We do live in a very high stress world. We do live in a high sugar environment too, that you could see potential for that GLP-1 hormone or peptide, I should say, to be naturally lower in some individuals just based on the food systems that we are subjected throughout our day-to-day life, and then therefore more prone for food noise. I also just think we grow up and we live in a very food as coping environment, meaning, oh, you're happy, have some food. Oh, you're sad, have some food. Oh, you did something good, have some food. We tend to turn towards food as, oh, get a shot, got a lollipop, did something good, go out for ice cream. Did something, had a breakup, eat a tub of ice cream. Like it just gets so normalized in society to use food that way. And I'm not saying good or bad, I'm just saying awareness. So, food noise can be triggered by very hyperpalatable foods, so like an environmental stimulus, so insight in mind, or stress, emotions, habits, so boredom, frustration, anger, joy, whatever that is. All of us are different, but can push us towards grabbing food items. So, it's dopamine seeking behaviors for some of it, and for some of it is if I had a nickel for how many people do not eat enough breakfasts, maybe skip lunch or have a very like light lunch, and then come home and are so hungry, and then they're also blowing off the steam of now I'm done with my workday and I have to get this done and this done, and et cetera, et cetera. So it's about asking yourself, am I hungry? Or am I craving? What is this? Am I looking for dopamine because I'm sitting at my desk at work and I'm working on this spreadsheet and I am so bored and I'm just reaching in this chocolate drawer to give me a dopamine hit. Um, or do I truly need carbs? Right? So you want to just be very aware of your meal timing, how balanced those meals are. We're going to do a whole presentation on this. But I think it's being aware of that, being aware of how we might cope and saying, okay, did I grab this food because I'm hungry, or did I grab this food because it was insight in my mind, or, I just got a text message on my phone from someone at 9 o'clock on a Sunday night, and now I'm a little frustrated or something, right? And I'm going for that because I'm frustrated. I'm not actually hungry, say. So I think it's being aware. Food journaling can be a really great tool because it's the concept of I write it, I bite it. It causes us to have that forced pause between having that food We're grabbing that food and consuming it or thinking about that food and consuming it to say, hey, do I need this? When did I just eat? What is my protein looking like for the day? Am I behind? Or, oh no, I've had plenty of food for the day. I'm full. I'm feeling good. I don't really need anything. I'm just grabbing this because I'm stressed or I'm bored or sometimes I'm tired, whatever it is. Humans go towards it for all different reasons. So to help quiet the food noise, in summary, to put this whole thing that's like a presentation really into just some bullets, is you want to eat regular meals, at least breakfast, lunch, dinner. Um, you want to balance those meals with plenty of protein and fiber. You want to look at your nervous system regulation, right? If you're very stressed, consider deep breathing or breath work. 4-7-8 is a great technique where you breathe in for a count of 4, hold for a count of 7, and release for a count of 8. When you exhale longer than you inhale, you can slow down your heart rate. When you inhale longer than you exhale, you can increase your heart rate. So that can just be a really good technique. Body scans is a great, what I call like rerouter of, oh, I'm stressed. I'm not hungry. I'm going towards this food. So what can I do to, what other thing can I do to mitigate that stress that would be equivalent to the food, if not better? Do some breath work. I can call a friend. I could go play with my dog, my cat. Someone could go play with their kid, call a loved one, go to the gym, knit, engage in hobbies, engage in other interests, reading. There's so many good things in the world. Food is great, but there's also so many other good things in the world. Play an instrument. I have some people that like to play the guitar. Think of things that keep your hands occupied. I had a gentleman who would go and play solitaire. You got to do what works for you. And it could be all different things in the tool belt as well. You could put a little note on your fridge, and even though, if you were to be asked what are things that make you de-stress, you could probably cite them off, or maybe not. And so it could be a good exercise to write that down on a cheat sheet and put it on your fridge. So then it's more of a visual stimulus because the knowledge is there. It's more of I'm seeing this list and saying, I'm looking in the fridge for what? How many times have we all opened the fridge and what are we looking for? It's some kind of gratification, dopamine, or maybe I'm bored, whatever it is. You close it and you look at that list and say, okay, that's my rerouters. I'm going to go call so and so. I'm going to go walk down the block and back at least, or I'm going to go make a cup of herbal tea and sit outside in the backyard and listen to a podcast or something or music or just hear my own thoughts. Um, Being aware of your cravings and your triggers are important in this, though. You want to create structure around meals. So, if you typically eat at a certain time or don't eat at a certain time, it can help with deciphering hunger versus cravings. Reduce exposure to hyperpalatable snacks in your environment. So, if it is a more environmental trigger, try to change your environment. And key reminders, food noise is not about willpower at all. It's about biology, environment, and stress. And a lot of it is about coping. So you want to connect with what is your real hunger and what is your real satisfaction, what is your real wants and needs. And we're going to go a lot more in depth with food noise, emotional eating, cravings at next month's presentation on August 18th at 6. It'll still be in the same format as today, recorded and virtual for everybody. But as we went into with those medications, there's a lot of factors at play, and we're all very unique individuals. So, of course, you see this graphic, and I think it's wonderful because it says here on the left, initiation of GLP-1 therapy with a patient-centered approach. So, all right. So first, what's going to get done is the completion of a baseline nutrition assessment and screening. What is this individual's labs? What have they done in the past that has worked or has not worked for them? Why do they want to go on the medication? What are their goals that they're trying to achieve? Those are just a few things, right? We went into family history, finances, insurance. There's a lot of things at play. We want to look at management of gastrointestinal side effects, what they might be prone for, or what they might be experiencing on the medication, navigating dietary preferences and intake. So, in all of this, there's also like what is the person like? What do they not like? What's their work schedule like? All the other areas of meal preparation that can go on to discuss. So definitely important. Prevention and mitigation of nutrient deficiencies. So being aware, right? Going in, I might feel overtly full. I have to really prioritize eating every 2 to 4 hours. Sometimes even if I don't feel strong hunger, I need to make sure I'm on top of my protein and my water at least. Um, Preservation of muscle and bone mass, as we've gone into, maximization of weight reduction efficiency. So doing this and doing it the right way so that the person is maximizing their time and their effort and in getting the weight down. Promotion of other supportive lifestyle measures. So, like we talk about sleep, mental health, exercise, etc. in this whole picture. It's not just, diet, it's not just medication, it's the whole wellness sphere. There are supplements that are marketed as GLP-1 marketed supplements because it is linked with gut health and different probiotics. So you're seeing some GLP-1 marketed supplements that have lactobacillus in it, or Akkermansia, or Bifidobacterium. That's great. That's honestly wonderful, especially if someone's GI tract is low in that. However, you just want to be aware of the sources that you're getting it from, and as well as, does this contain like prebiotics? So you are seeing some GLP-1 marketed supplements to have prebiotics and probiotics in it. Like the Kourtney Kardashian one here, the Lemmy one has like saffron, citrus, and polyphenols that they're good to take in. Don't get me wrong. I just don't think they're going to have a lot of bang for your buck, meaning that the GLP-1 marketed supplements, sometimes they market themselves as being comparable to the medication. They're not, especially in regard to potency and ability and effect. And some of them might help very modestly to just support a balanced diet, but on their own, they're not really going to pack much of a punch. Some supplements that could really be more helpful include like the Akkermansia muciniphila, which is the probiotic strain getting a lot of attention that can help to improve the GLP-1 signaling in the body. You could see the brand Metagenics does sell Akkermansia, and Pendulum is also another large brand with reputable Akkermansia strains and well tested. Um, you want to try to store them in the fridge because they can go bad and they are live strains of bacteria. And they may reduce inflammation and complement weight loss. So on their own, they're not really going to do much. It might just help to promote a healthy, balanced gut microflora, but on its own, not so much an effect. You would want to do it in conjunction with a diet that is rich in probiotics, prebiotics, protein, fiber, etc. Some prebiotic fibers. I really love this sun fiber here. It's about 10 grams of fiber, and you add it to your water, and it makes the water, you don't really taste it. You see a little cloudiness, but you don't really taste it. So for a fiber supplement, it's really wonderful. And can help keep digestion moving, essentially, especially if you experience some constipation while on this medication. So magnesium is another GLP-1 supplement that could be a helpful tool, like we were saying earlier, to help with constipation. But also, if you're an emotional eater prone for stress, the glycinate form can be helpful for managing stress. Who isn't prone to be an emotional eater? Berberine is a plant compound with insulin sensitizing effects, so it makes you more sensitive to insulin versus resistant to insulin. So that could be used and cycled. Omega-3s are very anti-inflammatory and may be helpful at enhancing satiety. If you don't eat fatty fish 2 to 3 times a week, you are likely deficient in omega-3s. Yes, you can get it from, say, chia seeds, walnuts, Brussels sprouts. For most individuals, based on your genetic traits, if you are not getting it from fatty fish, you likely need to eat like pounds of Brussels sprouts to get enough omega-3s, which is often not realistic. Uh, a high quality multivitamin. I do like the Thorn 2 a day or the Pure Encapsulations 1 as two just general multivitamins that are great for the general person to help prevent deficiencies. I do have a link here that if you're interested in these, that link is there, but there is no pressure for anybody. Just rather improve access. Of course, like we said, we're going to go into quieting the food noise. The name of the presentation will be Rewire Cravings, Reconnect with Fullness, and Regain Control. So this will be a presentation solely on food noise, emotional eating, and handling cravings. If that's one of the main reasons someone's going on the GLP, we want to work on that, whether they're going on the GLP or not going on the GLP or coming off the GLP medication. Um, I think managing these coping skills can be really wonderful tools to help with sustained weight loss. So we're going to go more into the mechanisms of hunger and fullness, ways to quiet that mental chatter around food and cravings, understand how stress, environment, and emotions hijack hunger cues, and then most importantly, come up with a realistic way to walk away and rewire those reactive patterns. But does anyone have any questions? And if someone does have questions that are watching the recording, just give us a shout. But most importantly, I do want to say thank you for sitting in on today's presentation and for your time and for signing up. So we will offer this as a three-part seminar again in November as part one, part two, and then adding the food noise in. If that's something that you want to share with a family member or a friend that you feel could really benefit. And then this recording will also be sent out tonight once YouTube and Zoom process. But I want to say thank you, and I hope that everyone has such a wonderful night. And thank you, as always, for helping me navigate the screen sharing.
Thank you.
Thank you, guys.